Good afternoon. This is Thursday, 15th July. I'm not going to talk about the judges or the law today. I'm quite tired, actually. Been talking about the same stuff for months. Today, I would like to talk a bit about the healthcare crisis we are facing. I like to urge the opposition, Perikatan Nasional, to take the lead in this national conversation on the current healthcare issue. The vacuum of leadership on this issue has allowed the Madani government to spin and confuse the public with technicalities. The explanation given to us about this two-tier system in the hospital, which they are proposing, is that no, they say this is not privatization because it belongs to the government. Ownership belongs to GRC, Kerajaan lah. But what in effect they are doing is they are introducing a two-tier system that will hurt the B40 and the M40 the most. You see, we have over the years always have this problem of this public hospitals being understaffed, underfunded, and overwhelmed in a way. And we have many good doctors and nurses and medical paramedics. They're all gone to the private sector, gone to Singapore, gone to Dubai for higher salaries. So our public health system is always under threat of some kind. Now, if the government diverts some of these resources to private-style facilities under the guise of public-private partnership, we are actually witnessing a functional privatization, regardless of who owns the equity. The rakyat doesn't care who owns it. They care whether they can get treatment without waiting 6-8 months or being pushed to pay for an upgraded services. The opposition must step in on this issue. MMA alone cannot fight this. MMA has been courageous, and the good chairman has been vigorous in challenging the spin, but MMA represents professional interests. They do not represent the political or the democratic voice of the people. The government's narrative must be countered. This idea that it is not privatization is semantic. It is semantic dishonesty. The true measure is access and equity, not ownership. The voters need a clear vision of our medical services, of our public health care. The opposition must show it has a plan to restore universal health care of quality for our public, for the public. I like to suggest the opposition should appoint a shadow health minister, or at least someone, or a caucus, or someone who has the skill, the know-how, who's credible, whether it's a doctor or health economist or someone respected by the profession, to lead a series of discussions, a series of town hall meetings with doctors, nurses, and the public, to outline the failures of the present system and build a case for reform, for change. We have, next week or so, or 2 weeks' time, we're going to have a parliament in session. Perhaps they should urge a white paper on all the issues, outstanding issues in the health services. And the opposition can also prepare a policy alternative. A national health service framework based on fairness, on public interest and public funding. We cannot have a system that unfairly divide the people. Those with money can go upstairs, those who don't go and wait for your turn, even if it takes months. Now, I believe the opposition must send a message. Satu Negara, Satu Sistem Kesihatan. That's what we have to do. Of course, there will be a room, and there will always be a lucrative business for the private services, private sector services. There's a lot of rich people in the country. And of course, they will still go to Pantai or KPJ or whatever, Prince Court, and all the many private clinics. Yes. But the government should not find an easy way out. They should try and build a better public health care services. Find a way to keep the doctors in. Yeah. Bring in more doctors. Even if they are not Malay doctors, doesn't matter. Even if they're from India or wherever, bring them here. Attract the best doctors for our market who can provide the services for the people. Or even if they're from Indonesia or whatever. Bring, in as much as we will also lose people, the good people, to other countries, we must also find ways to bring good people from other countries here. That's how we balance things up. I think the opposition should get this right. You can win back the trust of the people if you fight for the low income, the middle income Malaysians. They feel betrayed. They feel abandoned. It is an issue of dignity, and it cuts across race, age, and political divides. Thank you.